A person who has psychogenic anejaculation will actually have like nocturnal emissions called wet dreams. So this basically tells you that everything is working, the plumbing system is working perfectly. But maybe by talking about some male reproductive health issues, I am actually balancing that out without actually like practicing andrology or urology. Well, hello, you're welcome back to my channel. If you are a returning subscriber, big ups. I'm happy to see you here. And if this is your first time here, you are definitely in the right place. And this is the place where we give health related information that will help you make better health choices for yourself and for your family. And if this is something you're interested in, then definitely keep watching. So sperm cells are the male's reproductive cells that combine with a female reproductive cell in order to form a baby. So these stem cells are produced in the testes, and they are produced and each one that is produced usually lasts about 60 days, so that's about 2 months or so. So throughout every moment of every day, every minute, every second, every week, every month, the body is constantly producing sperm cells. And then if these sperm cells do not get used up, the body has a way of taking care of this. So there are different ways that these sperm cells could get used up. One is during sexual intercourse. So when you have sex, you can't ejaculate, and some of those sperm cells can leave your body. And the second is via masturbation as well. And then the third is as wet dreams, also called nocturnal emissions. So nocturnal meaning night, emissions meaning things that are going out of your body. So if your body feels like you have too much of those, your body has a way of taking care of those even while you are unconscious about the fact. So you could actually like sleep, and then when you wake up, you notice that there's some wetness on your underwear, or wetness on the bed around you or something. You might think that you have peed, but of course, if you are a man watching this, or an older young man watching this, then you know that of course that is not urine, that is something called a wet dream, and that what came out is actually semen. So there are some studies that have said that they found out that amongst men who admitted that they have sex more than 21 times in a month, that they actually like have a lower incidence of prostate cancer. This was quite interesting. However, another study actually said something quite the opposite. So I'm not about to tell you now that you should go trying to get out all the sperm cells in your body in order to reduce your risk of prostate cancer. It's not that straightforward. But if you are taking out the sperm cells in your body, then maybe you could actually benefit from having a reduced risk of prostate cancer. So for even people who are not like getting rid of sperm cells from their body, there are some people have said that they experience some benefits of not ejaculating, and then these are categorized into the physical benefits, the mental benefits, and spiritual benefits. So for some people, they find out that when they are abstinent from ejaculation for a particular time period, they feel like they have increased muscle growth, they have more stamina, like they feel physically stronger. Some of them also say that their hair begins to be fuller about that period when they are not actually getting rid of the sperm cells in their bodies. Some people feel that when they abstain from ejaculation for a particular time period, increases the possibility of them having multiple orgasms the next time around they decide to have sexual intercourse. And so if you are not ejaculating very, very often like that, some people think that it increases the quality of the sperm cells that a man produces. Then there have been also some admitted mental health benefits. So some people feel that when they do not ejaculate, they feel more in control of themselves. So that they feel like they have more self-control. They feel like they are masters of their own body, and they are not just like giving into any desire and all the whims and caprices of their bodies. For some people, they find out that they have reduced stress and anxiety when they do not ejaculate. For some other people, they could feel like they feel like increased confidence in themselves. They feel like, okay, I got this. If I can control myself, then I can control every other thing around me. Some people feel that they have better focus and concentration when they are not channeling their mental energies into how to either have sex or masturbate or otherwise get sperm cells out of their body. So they feel like if they are focused on work, for example, focused on academic business, that they are more able to devote themselves to what they are doing when they are not as carried away with trying to find ways of ejaculating. And some people also have said that they have some spiritual benefits as well. So spiritual now is not necessarily in relation to any one religion. So in this context, the people who have admitted that they have spiritual benefits to it have said that they are more able to have more meaningful relationships with the people in their lives. So instead of just constantly trying to either have sex or ejaculate or something, they are more able to, interact emotionally with the people around them. Some people feel that it also improves their overall happiness, so that when they are in this place where they know that they have control of their bodies, that their overall happiness and their interaction with nature and all of life is actually improved for them. So if you are ejaculating on the regular, maybe having sexual intercourse or doing something otherwise, there could be some benefit to that as per reducing your risk of prostate cancer, even though that's more studies need to be carried out in that regard. And then for people who are also not ejaculating as often, there are also some advantages, as these people have said. So these advantages, you might not find them in a medical textbook, but then these are things that people have admitted about themselves that they have observed when they are not regularly ejaculating. This is the middle of this video, but if you like what you're getting so far, I'd appreciate it if you tap that like button and if you subscribe to my channel. Thank you very much. All right, let's continue. So there are actually like three major reasons why a person may not be ejaculating, and then one is as a result of voluntary abstinence. So a person could decide that because of these benefits that they could get from not ejaculating, the benefits of self-control, of increased self-awareness, of having better focus, having increased stamina, having increased energy, that they want to stay off ejaculating for a particular time period. And that's okay too. So that's referred to as intentional abstinence. So also some people also feel that it also increases their fertility, such that whenever they now decide that they want to ejaculate and try for a baby, that the sperm quality that they have during those periods is usually better than when they are ejaculating on a regular basis. A second reason could be as a result of retrograde ejaculation. So normally when a person ejaculates, the sperm cells contain in semen. So semen is the fluid that comes out, sperm is contained in semen. So the semen is ideally supposed to come out of the penis through the urethra. Urethra is the urinary opening inside of the penis. So in some people, they have something called retrograde ejaculation. So basically it means backwards ejaculation. So instead of the semen going out through the urethra and then out of the penis, this semen goes backwards and goes into the bladder where urine is stored. So a man could find out that he's passing urine that seems somewhat cloudy, and when he actually either has sexual intercourse or when he masturbates, like semen is not coming out, or maybe very little is coming out. So this could be like one of the reasons for that. However, it's not harmful. Nothing bad is going to happen to you if you're having retrograde ejaculation. But if you are somebody who would like to have a child, this could actually like hamper or reduce your fertility. And then the third reason why a person might not be ejaculation is as a result of something called anejaculation. Anejaculation means no ejaculation. This could be primary or secondary. Primary meaning that throughout this individual's life, either he might be a teenage boy or he could be a man and he has never ejaculated, never had a wet dream, nothing of the sort. That's called primary ejaculation. And then secondary ejaculation is ejaculation that occurs as a result of some insult or some injury to the body. So this could be like a spinal cord injury, this could be like a disease like multiple sclerosis. This could also be as a result of injury to the penis or surgery on the penis, and then could also occur as a result of drugs as well. And it's also worthy of note that there's something called psychogenic anejaculation. So this means that a person has no physical problem with their body. So a person who has psychogenic anejaculation will actually have like nocturnal emissions called wet dreams. So this basically tells you that everything is working, the plumbing system is working perfectly, but this person is not ejaculating in situations where their ejaculation is called upon. This could be, for example, when having sexual intercourse with a partner that they might feel very tense about or uncomfortable with, or in some cases the person who has been asked to produce some semen for maybe a semen analysis, he's asked to masturbate and produce some semen for the semen analysis, and he finds out that in that instant when he's supposed to produce that, he's unable to. So this can occur as a result of the functioning of the mind. So I like to tell a short story. So when I was a medical student, I observed that in a particular field called obstetrics and gynecology, that's the field of medicine that deals with issues related to pregnant women and issues related to female reproductive, organs, from the ovaries to the womb to the cervix to the vagina and to the outer genital area in women. So I found out that most of the doctors who dealt with this particular part of the body were men. It seemed like 85% of them were men, and the women were like in the micro minority. So I'm like, why are there so many men in this business? So I used to joke and tell a friend of mine then that I was going to specialize in andrology, and like I was going to go and work on issues related to male reproductive area, the male genital area, and all of that. But as I grew up, I realized that I'm not about to make a career choice just because I'm trying to level out the gender disparity. But maybe by talking about some male reproductive health issues, I am actually balancing that out without actually practicing andrology or urology. Anyway, so if you like this video, please give it a thumbs up, and if you'd like to see more content from me, please definitely subscribe. And I'd like it if you share this video with your village people, with your family and your friends. And I will see you in my next one. It's been a pleasure making this video for you. Have a beautiful day. Bye.